Are you someone who's been diagnosed with scoliosis recently, or do you just have an interest in scoliosis and you're wondering what current advances in scoliosis treatment there are and what the research is showing recently with scoliosis treatment? Well, you're in the right place. I'm Dave Butler, and this is the Scoliosis Experience podcast. Today, we're going to really dive deep into some of the things that have come out recently and how they affect scoliosis treatment, and just to give you an update on what is currently being done. So I'm grateful you're here, and I hope that you learn something from this podcast episode. So let's get started. Scoliosis, usually we think about scoliosis as idiopathic adolescent scoliosis. Idiopathic meaning of unknown cause. And it's interesting to me that we still have a lot of idiopathic scoliosis that we don't know the cause. Even though scoliosis has been around for a long time, it's been studied for a long time. It's interesting to me that we don't know the cause, and there are a lot of theories and a lot of thoughts on what causes scoliosis, but it's interesting that for most cases of scoliosis that I see in the clinic, we don't necessarily know the cause. We can speculate if it's genetic or it's something like that, but we don't have a specific cause. So today we're not going to talk about specifics in diagnosis and what causes scoliosis. Today we're going to talk specifically about treatment. And treatment can be divided into three categories. We have conservative treatment, like for exercise-based treatments for scoliosis. We have bracing treatments for scoliosis, and we also have surgical treatments for scoliosis. So today I want to kind of break it up into those three sections and talk about some of the advancements and changes that I'm seeing in each of those sections. So let's begin with talking about surgical interventions. One of the studies that I saw recently that was very interesting to me was a study on spinal mobility and surgical outcomes. The study came out within the last year, and it looked at stiff scoliosis spines, if they worked on spinal mobility before surgery, if they could improve the surgical outcomes. Surgical outcome being how much correction they could get in the surgery. That was an interesting one because thinking about stiff scoliosis spines, it makes sense that the stiffer the spine, the harder it is to get a good correction in surgery, as well as a good correction with exercise and bracing. So what they did is they took 5 days before surgery, and the patient was put in an inpatient setting, so they were in the hospital setting basically, and they worked on spinal mobility a lot during those 5 days prior to surgery. And they found that increasing spinal mobility did improve the outcomes of the surgery, that they got better correction of the spine and they had less asymmetry of the spine following surgery. So that's cool, and we're talking to a couple of the surgeons in the area about developing a protocol for pre-surgery to get increased mobility, and so then if we have increased mobility, we can get better outcomes. And so that's something that's cool on the surgical side. And the more mobility and the more flexibility we have in the spine, I'm thinking that we would have better recovery as well. And that's something that needs to be researched further. But hopefully in the near future, we'll have a good protocol that we can use before surgery to improve mobility, so that after surgery, the results are better with that correction. Most of the time when we see surgical fusion and surgical correction of the scoliosis, we're not seeing a lot of residual curve of the spine. We're not seeing a big scoliosis curve that's left. But sometimes we do, especially in those stiff spine cases. And so having something that we can do that reduces that is really helpful. So as far as surgery goes, that's one of the big ones that I've been seeing. The other things with surgery, we're still seeing a lot about VBT, vertebral body tethering. I've had more patients who have had vertebral body tethering in the last year, and they seem to be doing really well. Some of the research is still talking about complication rates and failure rates of the tethers, but overall, the patients that I see in the clinic, I see good results with VBT overall, but I think some of those, it's still something that we're watching and trying to determine which patients are the best for that. I did have one patient recently who has Marfan's disease, and normally most surgeons won't do VBT on someone with Marfan's because the connective tissue quality is different, and so they worry about the fixation of the bones. But I did have my first Marfan's patient who had VBT. So we'll see how she does. That was just a recent thing. So there's advancements in that kind of thing, but we'll see. When we have new surgical interventions, I'll bring those up and we'll talk more about those. So if we talk about bracing next, one of the cool things that I saw in the SOSORT meeting, the International Society of Scoliosis Treatment meeting in Boston last April, was a couple of prototypes with 3D printed braces. And it was actually really cool to see, because these 3D printed braces, they don't have to be the same width everywhere. And so where they don't need structural strength and integrity, they can make the brace smaller and thinner. And they can also add more holes and more breathability to the brace, because they can choose where they don't need as much structural strength, and they can put more holes and openings, which makes it more comfortable for people because they don't get as hot, and it's a thinner material, so it doesn't insulate them quite as much. So I saw these 3D printed braces, which they look really cool. And one of the coolest things that I heard about, and I don't know how long it will be before we actually have something like this, but scanning a patient with a three-dimensional scanner, and then using that in conjunction with an X-ray of their spine, and feeding that into an AI algorithm, AI prediction model, to then create the brace in the best way depending on what their curve looks like and what the contours of their body are like. And then having that AI modeling 3D printed on a 3D printer. I think that's probably, I don't know, I'm just totally guessing on this, but I think that's probably 1 to 2 years out. We'll probably have 3D printed braces here in the next 1 to 2 years. And the AI modeling and prediction models are getting better and better. So I could see that happening in the next 2 to 3 years. And I think that's really cool. I think there's going to be a place for orthotists to still direct that process and modify bracing and things like that. But now with 3D printing, being able to print thermoplastic, so that's the kind of plastic they need for these braces, it's pretty cool, because I think we'll be able to see braces come out faster. They won't take as long to fabricate. And I think we'll see a lot of advances with that. So 3D printed braces is a big one on the bracing side. Recently, I think this was within the last 6 months, I saw a study similar to the one I talked about with surgery and spinal mobility. I saw a research article that looked at spinal mobility and the outcome of bracing. If increasing spinal mobility increased the ability of the brace to do its job and to have a better outcome. And it showed that the better the spinal mobility and flexibility, the better the result from bracing. This makes total sense to me, because a brace is an external correction. So it's pushing from the outside, trying to push the spine more towards midline. And if there's a lot of stiffness, it can't push the spine as far as it needs to for correction. So if we increase spinal mobility, especially in those that have stiff spines, we increase the ability of the brace to do correction. And I think that's really cool. And I think it's something that we need to focus more on. If someone is braced, we should be working on spinal mobility to get them the best result possible when they are braced. And I could see a few different ways of doing that. Seeing them in the clinic and working on spinal mobility manually, as well as self-stretching and things like that, I think would be helpful. But I think we could also develop a good home exercise program and a home mobility program that will help them to increase their spinal mobility and get a better result in bracing. And that's something that I'm going to be working on in my clinic to develop a protocol for spinal mobility. We want to use that for those pre-surgery cases as well as those who are being braced. And that should yield a better outcome in both of those cases. So if we think about that a little bit, bracing benefits from more spinal mobility because the spine can be pushed to where it needs to go. My thoughts go to, if that is helpful, why not also work on spinal mobility more to get better correction with scoliosis exercises? So like the Schroth Method or the C's approach or something like that. The more mobility we have, the better that patient can get into that correction. So it was interesting enough that I brought this up with my other therapist, and one of my other therapists, Corey. He said, I've always thought of scoliosis as an instability problem, like the spine is unstable and it's moving in a direction we don't want it to move, and that's not in midline. And we talked about that for a little while, and I think while scoliosis is an unstable progression of the spine, for those cases that are stiff and those cases that lack mobility, if we can increase that mobility, that should be beneficial because then they can get into a better correction when they're doing Schroth exercises or C's exercises. So if someone is way flexible and loosey-goosey, that is not someone that I'm really going to be working a ton on with spinal mobility. It's the cases where it's just stiff and tight and just not moving. That, along with my kyphosis patients, I think they would benefit from mobility a lot as well. So it draws my mind to, is there more that we can do with spinal mobility and other things other than the Schroth method, things that can complement the scoliosis specific exercise that we do. As far as bracing goes, those are the two things that are kind of on my mind. I think 3-dimensional braces are pretty much standard at this point, and that's fantastic. I love seeing that. I don't think there's a ton of other bracing advancements. There is the whisper brace, which is one that allows for movement, but I haven't seen great results yet with the whisper brace, and it seems like it's hard to fit and it's hard to take on and put on and take off. So I'm still waiting to see the results from the whisper brace. Some of the topics that I see in research with scoliosis specific exercise, there was a research article recently that looked at, are we going long enough term in our treatments? Meaning, a lot of studies look at 6 to 12 weeks of treatment, maybe up to 3 months of treatment, and the outcomes that happen in that amount of time. But should we be looking longer, like 12 to 24 months, looking to see the outcomes at that point? The study that I'm thinking of looked at the patients were seen for 12 months, and I think twice a week for 12 months. So they were actually seen in the clinic for a lot more time and a lot more visits than we normally do. And they were showing great outcomes with that study. It makes me wonder, are we doing enough? A typical protocol at my clinic is we usually see someone about 12 visits until they learn the exercises well enough to do it at home. And then we kind of switch to a 3-month follow-up model where they can be seen every 3 months to make sure things are going okay and to review and progress. But this protocol in this study showed, they used twice a week for 12 months. I think sometimes financially and insurance-wise that's not doable and that's not possible, but are we doing enough to really get the results that we need to be getting? Part of the reason I think about that is most of these kids are being treated for scoliosis for years. This is not something that they're only being seen for a few months. So if we're only studying this for a few months, we don't get the full picture of what this looks like at 12, 24, 36 months. And so it makes me wonder if I need to change my long-term approach, and maybe not having people in the clinic that much, but following up with them more often with telehealth and other things like that we have the ability to do now. So that's one thing that we're looking at with the exercise treatment of scoliosis. One other big thing recently, we've been using the Momentum Spine app to use topography to image people's spines from a distance. The Momentum Spine app allows you to scan and use topography on your back from your phone. And that allows us to get some imaging of the spine remotely, which is really cool. It's something that I was skeptical about and didn't know if it was actually as helpful as it seemed. But the more I get into the Momentum Spine app and the more I talk to them, the more I think this is probably the direction that we're going with monitoring scoliosis. If we can limit x-rays with these patients, and if we're monitoring the spine, they're doing their exercises well, or they're bracing well, and we're not seeing any progression on topography, do we need to do as many x-rays? Why do we need to do an x-ray if we can confidently say that we haven't had significant progression? I'm not talking about 2 degrees of progression or 3 degrees, because that doesn't really change our treatment approach anyway. I'm talking about someone with a 15-degree curve or 25-degree curve or whatever. If we can accurately predict if they have progressed 5 degrees or not, that can limit a lot of x-rays. We've been using this a lot with our patients, where we'll use topography. We've been using topography for 10 years, just not the Momentum Spine app. And if we're not seeing changes on topography, then we push that x-ray back a bit, because it's not really necessary. The x-ray is only to see if we have had progression. Sure, we want the diagnostic x-ray in the beginning. We need that. But we don't necessarily need to x-ray every 3 months, every 6 months, if there's no changes. So topography is something that I'm seeing more and more in the literature and the research, and I think it's something that will continue to get better. One cool thing about the Momentum Spine app is that there's an AI prediction of the Cobb angle. It's not 100% accurate, but it does give us an idea if there are changes that the AI model sees as a problem. And that then we can use that to make decisions whether to do an x-ray or not, or whether we have progression or not. And I think that's really cool, and I think it will just keep getting better as AI modeling gets better and as it gets more data. And so that's something that's really exciting in my clinic, that we can monitor curves. I know a lot of parents that are, especially with kids, that their curves are in the 30s, mid 30s, or early 40s, and they're concerned about that progression. Being able to scan your child's back every other week and tracking that progress to make sure that progression isn't happening, it kind of keeps you on your exercises as well, but it can give you the peace of mind to not worry as much that progression is happening. So I think in my clinic, the Momentum Spine app is probably one of the big things in 2025 that we're really going to be using to augment our treatment. We've also been looking at a few different things surrounding surgery. So a post-operative protocol, so that those patients who end up having surgery, that they recover better and with less pain and less limitation. Most patients who have scoliosis fusion surgery do really well, and they don't really need a ton of help, but there are a decent number of them who continue to have pain and continue to be limited in what they do. And I really think that having a post-op protocol that they can use, and most of this is actually from home, this isn't something that they need to come into the clinic. You can find it on our website even. We've published videos and a post-op protocol on our website that you can look at as well if you've had surgery. And if we can reduce the problems after surgery and improve strength and mobility where we need them, then we should have a better outcome from those surgeries. We should have better alignment. We should have better strength and get back to those things that these kids want to get back to. So if you haven't checked that out, feel free to check that out. I forgot to mention this, but the research articles that I've been talking about on this podcast, I'm going to put links for those articles in the description, so check that out, and you can see the research articles that we use. So there are some other research articles on like manual therapy and chiropractic type treatment with Schroth or with scoliosis treatment. I'm not seeing great results with that, and there's just not that strong of evidence yet for that. So maybe we'll talk about that in a future podcast episode, but right now that's not really something that is piquing my interest. We do manual therapy on our scoliosis patients. We do spinal mobilization and manipulation if we need it, but the research isn't something that is very strong right now. So those are the things that I'm seeing in the literature. Those are the things that I'm seeing in the scoliosis world, and hopefully that gives you an idea of where we're going and where we are with scoliosis treatment. I would say in the last 5 years, we've been having a ton of research come out about scoliosis treatment, conservative scoliosis treatment, which is really exciting because it has not been that way prior to about 2015. We really didn't have a ton of research backing what we do. And now we're seeing more and more studies that help to back what we do. I am going to be going to Croatia for the SOSORT meeting in 2025, the International Congress on Conservative Treatment for Scoliosis. I'm really excited about that because I think we'll see some really cool things, some really cool research articles at that conference, and I'll bring that back with me. We'll talk about that on this podcast and keep you updated on what's going on. I'm really excited for the direction that scoliosis treatment is going. I think for so long it was a wait and see approach and waiting for surgery and some bracing, and I think that's starting to change, where we're using bracing in concert with scoliosis specific exercise, and we're seeing the research and the results to support that and really help us to do what is best for our patients. So thanks for listening. I appreciate you sticking with me for this podcast episode, and we'll do more episodes around advancements in scoliosis treatment, and I'll try to get some other people on to talk more about their experiences or their expertise as well. So thanks for listening, and we'll catch you next time.